Hello, everyone. I'm just going to give it one more minute for everyone to be able to join if they're stuck in the lobby. And just a couple of housekeeping items before we get started. So I have the lovely Amanda Whitehead with us. She is on the webinar and she'll be facilitating the chat. So if you have any questions throughout the presentation, please do feel free to submit those questions in the chat box and Amanda will help me out and she'll let me know when there are questions. All right. So today's webinar is half an hour long. I'm going to do my best to wrap up in time, and I do really appreciate all of you being here with me today. We are talking about a very thematic topic, fortifying the immune system with herbs. And without further ado, I'm going to dive right in. So my name is Dr. Emma Lee. I am a naturopathic doctor and I practice in Vancouver, and my practice is definitely general focus, meaning that I see a little bit of everything and certainly a lot of colds and flus right now at this time of the year. So in the winter time, when we're talking about kind of what to think about and what to pay attention to, I always think about kind of mimicking the natural seasons. And so in the winter, it's really a time to slow down, to hunker down, to have like earlier mornings, but also earlier bedtimes. And this is the season when everything in nature slows down, and naturally everything in our human bodies also, there's a little bit of a hibernation mode that happens. So it's an opportunity for us to tune into ourselves and to support our immune system through a lot of rest, a lot of self-care, and a lot of self-care practices, whatever that means to you. When I talk about immune support, my number one focus for my patients is always to think about how do we support stress resilience and stress management. So the reason why I bring up stress right away is because there's a huge relationship between the way that we digest stress and the way that our immune system functions. If any of you have ever encountered the situation, if you've ever been really stressed at work or you have a big deadline at school and it's go, go, go time, and then the moment you're on vacation, the moment you're able to let go, that's when you get a cold or that's when you get that massive flu. It's because when the stress response is heightened and sustained over a long period of time, stress and cortisol really, really puts a damper on our ability to clean house and our immune system to be able to kind of do the daily housekeeping stuff, like, making sure that there's no like bugs that are lying around. And so it's an immunosuppressive mechanism that happens in our body because our body can't deal with that at the moment. And then once cortisol decreases or the stress hormone decreases, that's when the immune system is able to finally come back online. And then it has a little bit of a freak out. So it realizes, oh my gosh, there's, a virus here and a bug there. And now we have to mount this massive inflammatory response and to be able to kick that out. So rather than having that sort of be the pattern that you carry forward with you, I invite you to think about some ways that you could weave self-care habits into your daily life to really increase that stress resilience and manage that stress response so that it's a little bit more of an adequate stress response and isn't actually completely suppressing your immune system. And there are lots of ways that we can do this. It can look like eating well. It can look like making sure that you're spending time in nature, getting adequate sleep. And one thing that I really, really love is making sure that you're actually getting out underneath trees. So the reason why I say trees is because all of the trees in our ecosystem produce a lot of phytochemicals, and they're phytochemicals that we breathe in as well. And they help us regulate not just our immune system, but also our nervous system. And so there's a lot of really great research on Shirin-yoku, which is a Japanese term for forest bathing. And it's been shown to improve mood, decrease blood pressure, improve immune system, and it doesn't have to be much. Something as little as 20 minutes 3 times a week. And for those of us that are fortunate enough to live in the beautiful Pacific Northwest, we have lots of nature accessible to us. It doesn't have to be, deep in the woods. It can actually be something as simple as just walking underneath a tree-lined street if you're in Vancouver, like I am, and that has proven to be beneficial. So the things to avoid are things that increases inflammation or increases stress or decreases our response and stress resilience. So things like processed foods, things that are heightened our stress response. And then a really big one is the constant doom scrolling on social media or just kind of the mindless scrolling. There's a really big link between dopamine depletion, which is what happens when we're constantly scrolling on, let's say, Instagram. It's kind of that like hit of a little bit of dopamine over time really decreases our own dopamine production, and a lack of dopamine has been shown to be distressing for the immune system. So that's the connection there. Okay, so what are we actually talking about when we're talking about the immune system? And this is a concept that I want to introduce to you because it really helps us to structure which herbs to use when. And there are essentially two facets of our immune system. On the slide, we call it the deep immunity and surface immunity. Another term for it would be adaptive and innate, adaptive being the deep immunity and innate being the surface immunity. So the analogy that I like to use is the deep immunity or adaptive immunity is kind of like your hospital. So it's constantly functioning. It needs to function well in order for you to not get very, very sick, and it needs to be supported through the entire year. Surface immunity is kind of like your first responders. So your ambulances, your fire trucks, it's what arrives on scene when you are first meeting a pathogen. So whether it be viral, parasitical, or bacterial in nature, whenever you're exposed to something new, your surface immunity is what arrives on scene first and your first line of defense. So we'll break down these two concepts and herbs that are appropriate for both. Essentially, the overarching architecture is that herbs that are appropriate for supporting our deep immunity are herbs that can be used over a long period of time because they're immunoregulators, meaning if your immune system is suppressed, it helps to bring the immune system function up. If your immune system is overactive in the sense of, let's say, maybe autoimmune inflammation, then it helps to calm that immune system down. Whereas herbs that work on surface immunity or that innate immune response, the first response immune system, those are immunostimulant herbs. So they really help to just stimulate all of your white blood cells that are first responders, your neutrophils primarily, and natural killer cells, etc. And they help to increase those numbers so you can really, really try and decrease that viral or bacterial load right out of the gate. Okay, so from a physiological perspective, deep immunity, we can think of it as your lymphatic system, your bone marrows, your deep lungs, and then surface immunity are things like all of the tissues that are first exposed to a pathogen. So all of your mucous membranes from your oral pharyngeal cavity all the way down to your gut, because you definitely expose yourself if you think about things like the norovirus, expose yourself to pathogens via that digestive system, and then also your skin. All right, so deep immunity, and these are the immunoregulators. So all of the mushrooms really fall under this category. Mushrooms are very safe to be taken long-term. They're really great for either immunosuppressed conditions like cancer or hyperactive immune conditions like autoimmune, specifically when they're in flares. And we'll focus on three primarily over the next few slides: chaga, turkey tail, and reishi. They're some of my favorite mushrooms. Reishi and turkey tail are two of the most researched mushrooms with many, many studies that are supportive of their benefits. And As you probably are well aware, if you're familiar with Harmonic Arts products, there are lots of ways that you can take mushrooms, from loose powders to tinctures, to like mixes that you can make into like hot beverages and elixirs. There are lots of ways that we can ingest these beautiful medicinal foods. So chaga. Chaga is a mushroom that modulates the immune system. And we can honestly say that of most of the mushrooms that they're immunomodulators, meaning, like I said, again, it helps to regulate within an ideal range. Chaga is specifically very rich in antioxidants, is very anti-inflammatory, very antiviral, very anti-cancer. It's actually 31 times more potent than blueberries when it comes to its antioxidant levels. And so it's very, very protective of our DNA. Turkey tail is a very gentle modulator of our immune system as well. And it's specifically, you can think of it as a gut health supportive mushroom. So working on both the deep immune system, but as well as the surface immune system in the gut. It's great as a prebiotic. It helps to support liver function and detoxification. And it's also anti-cancer and very, very supportive of cancer treatments. So can be used as an adjunct in active cancer care. Reishi is another immunomodulating mushroom. It's adaptogenic specifically for our stress response, which is why we wanted to highlight it in this presentation, because of that dual nature of we're not just wanting to modulate our immune response, but we're actually wanting to really address our stress response, because the two go hand in hand. It's very beneficial for helping you achieve more restful sleep. It's great for the cardiovascular system, so has an affinity for your heart and your blood vessels. And in Chinese medicine, it's referred as the mushroom of immortality because of its all-encompassing health benefits. So very, very desirable. Used to be very rare in nature, and we're very glad that we're able to grow this in a farmed setting because more people can benefit from it. The other aspect of its application that I use reishi a lot for is its antihistaminergic supportive care. So it's really helpful for those of us that have asthma that is aggravated by an upper respiratory infection. So if you're someone who notices that you need more of your puffer medications with upper respiratory tract infections, reishi might be a mushroom that you want to explore. It's very helpful for decreasing the inflammation in our respiratory tract. All right. If you don't know which mushroom to use, this is a beautiful option, the 5 mushroom blend, and it comes as capsules, it comes as tinctures, and then my favorite is the loose powder that you can make into like a hot cocoa or add to any of your foods and meals. So for example, if you make a soup, you can definitely sprinkle some 5 mushroom powder blend into that. And with the mushrooms specifically, I would definitely recommend following the dosing on the packages. There are dose recommendations in all of the Harmonic Arts products. And for some of the herbs that we'll see in more of the surface immune kind of supportive herbs, there is the possibility of increasing the dose in the short term or the acute term to fight off any infections, but I would definitely have a conversation with your primary care provider, whether it be a naturopathic doctor or someone else, to understand what that dose looks like for you. But for mushrooms specifically, I would recommend following the instructions. All right, so just as a reminder, the 3 ways to take your mushrooms. And if you do want to remember this, I welcome you to take a picture of the slide. It's quite useful, and it tells you what to or how to administer these medicines. Okay. A couple more herbs for the immunoregulating category are astragalus, and then the next one we'll talk about is elecampane. So astragalus, I love, love, love. I love this as a tincture as part of the immune depth. I love it as a dried herb. It is very, very helpful for boosting the immune system, specifically in the upper respiratory tract. So very helpful for low immune function in the lungs, for helping with bronchitis or chronic coughs that don't go away. It's very rich in antioxidants, and the immune depth tincture specifically is a very, very nice blend. It tastes really good. I've even had success giving this to some younger patients, and so you could definitely try this with a child if you have children at home. And then it's very helpful also for helping to protect ourselves from free radicals and to help our body adapt to stressors. So some of the other herbs in the immune depth that you might want to know about are echinacea and reishi. So again, a couple of the herbs that we've talked about, reishi and echinacea, you're probably really familiar with. And so immune depth is a product that I would consider straddles both worlds. You can definitely use it safely over the long term because of the immunoregulating properties, but you can also high dose this in the short term if you're feeling like you're being exposed to a lot of bugs or you're feeling that tickle come on in the back of your throat. And then elecampane. So Inula is the Latin name, and elecampane is a mucilaginous herb, meaning it's quite soothing and coating. If you've ever had elecampane on its own, it has almost like a slippery taste and texture to it, and it's very coating for the respiratory tract and the back of the throat, so eases any type of cough. Eases congestion, and really helpful for treating conditions of the upper respiratory tract that are aggravated by upper respiratory infections, so bronchitis, asthma, etc. Very, very antibacterial as well. And elecampane, in terms of harmonic arts products, can be found in the lung cough syrup and then the breathe artisan tea. So just a little quick note regarding tea blends. For most teas, because active ingredients are present in both the water-soluble components and also oil, I would recommend that when you're brewing a tea that you brew it covered, meaning loose leaf or tea bag, hot water, and then you cover it while it's sitting on your counter for 5 to 10 minutes. And then before drinking that tea, I would drip the condensation back into the cup. Similarly, if you prefer to drink your tea kind of a little bit on the cool side or room temperature side, you could definitely do so, and then just keep it covered throughout that entire brewing time, and then drink it out of a lidded mug or drip the condensation back into like a lemonade, and then you can drink it after. All right, so that's it for deep immunity. For surface immunity, so talking about all of the immunostimulating herbs, these are herbs that you would reach for in your medicine cabinet when you're feeling like you're about to come down with something. So really, really helpful for stimulating that innate immune response. And a really traditional and typical herb that we see is echinacea. So it's a gentle stimulant of the immune system, which is why it's appropriate for children and adults alike. It's especially helpful for the upper respiratory tract, and it's very, very good at preventing against viral and bacterial pathogens. In terms of harmonic art products, I really love the throat spray that you can spray into the back of your throat. So it has a very, not just obviously systemic action in terms of stimulating the immune response, but a very local action in terms of its antiviral and antibacterial nature. You could also do the cold defense tincture blend. And then again, the defense artisan tea also has echinacea as well. Okay. Next, we have golden seal. Golden seal is one of those herbs that contains berberine. Other herbs that you may be familiar that are berberine containing are things like Oregon grape. It's an immunostimulant, specifically an alkaloid. It's very antimicrobial, very anti-inflammatory, great for helping boost our GI immune system, that mucosal immune system response as well. And also very helpful for any type of viral pathogen that's specific for the GI tract. So something like norovirus, I definitely would consider golden seal for. It's present in the cold defense tincture. And it's not a particularly pleasant tincture, just because the berberine alkaloid is a little bit, it's high in tannins, it's a little bit bitter. And so if you're administering this to little kids, I definitely would consider like a carrier medium like Manuka honey, so that you can double down on that antibacterial property as well. And then you could even hide it in something like a syrup, an elderberry syrup, which we'll talk about in a couple of slides. All right, usnea, or old man's beard. This is what you see hanging off of all the tree trunks in our Pacific Northwest forest. This is another mucilaginous herb, so very, very helpful for soothing irritated respiratory and upper respiratory tracts. It's also very helpful for fevers, so it helps to bring down fevers that are too high. It's very calming on over-inflammatory conditions. And it's very helpful for fungal infections as well. So if there's a component of candida to your upper respiratory tract, meaning if you're someone who's prone to candida infections, whenever you get an upper respiratory tract, you notice that it flares up candida, this would be something that I would consider. Again, in the cold defense tincture. So you probably are picking up that cold defense tincture is a good thing to have in your medicine cabinet, because it fights off so many of these different possible infections. So not just bacterial, viral, but also fungal, which is a very intentional formulation on the part of Harmonic Arts, is to make sure that it takes, I think, like you having to think about and you having to choose the appropriate formulation out of the equation. And this is just one of those really, really well-rounded formulations that's appropriate for any type of acute infection that you might encounter. All right, so elderberry is one of my most prescribed immune supportive agents in my clinic, because I also see a lot of kids, and elderberry tastes fantastic. It almost has a little bit of like a berry or grapey type of taste, and it's even better if you get the elderberry syrup. So elderberry syrup works just as well as any tincture, because a lot of the active ingredients in elderberry are actually extractable in a glycerin solution. It strengthens all of our natural immune defenses, our innate and adaptive immune system, so very appropriate for both long-term and short-term use. And you can high dose it for sure if you're already fighting off an upper respiratory tract infection, to shorten the duration of that infection. And it's both antiviral and antimicrobial, and also it's also very nutritive. So packed with vitamin C, antioxidants, flavonoids. I typically recommend families to either give it straight on a spoon, or you can even incorporate this into foods. So things like mixing into, like some sort of yogurt, oatmeal, or even making it into popsicles or some sort of treat would be very, very appropriate for a much younger child. All right. And then lastly is Osha. So Osha is a herb. If you haven't heard of it before, I invite you to familiarize yourself with it. It's a beautiful respiratory herb. So any respiratory tract infection, I try to incorporate a little bit of Osha, which is part of the cold defense formulation. And it's specifically very antiviral. And most upper respiratory tract infections are actually viral in nature, which is why antibiotics are not typically a great first line solution, because antibiotics do not do anything against viral infections. And it's part of the reason why, if you see a primary care provider, the most typical recommendation is just watch and wait and comfort management. But from a herbal perspective, we can definitely do better than watch and wait. We can use antiviral formulations like the Cold Defense that contains OSHA. And then it also helps with resolution of inflammation. So whenever we mount an immune response, because our immune response, part of it is inflammation, it's always nice to think about not just how do we support that initial inflammatory flare, which is very needed, but how do we support the body in its detoxification procedures in terms of being able to clear that inflammation and clear those inflammatory molecules in an efficient way. So OSHA also helps with liver detoxification, and you can think of it as an antioxidant herb in that way. Okay. So how to use tinctures. Tinctures can be used straight from the dropper, and this is something that you would administer either into the mouth or into a cup of water, and you would drink it back. It's not a homeopathic, so it's not under the tongue. And for those of us that are trying to avoid alcohol, what you could do is to have a very, very hot cup of water or half a cup of water, administer your tincture in that, and let it sit on the counter and let the alcohol evaporate off for 5 to 10 minutes before drinking it back. Again, for dosing, I would recommend following the label unless you're working with a primary care provider that can help provide guidance in terms of more customized dosing for acute versus long-term usage. And then syrups are wonderful. I really love syrups because they're so tasty, they're easy to use, and it's something that you could keep in your cupboard for the entire family. It tends to take also kind of the edge off some of the herbs that are maybe a little bit too bitter or a little bit too spicy, like ginger in a syrup tends to be really wonderful and a lot better tolerated by little kids. And so you could use it not just for immune support, but also for digestive support and therefore immune support through a roundabout way as well. Really helpful for constipation for little kids too. And then similarly for the lung and cough syrup, it's really lovely because it takes some of that bitterness kind of out of the equation. So all of the herbs are organic and wild harvested, and that's part of the reason why I love working with harmonic arts so much. It's because there's not just a lot of thoughtfulness that goes into the formulations, but a lot of thoughtfulness in terms of how the herbs are grown and harvested, and the sort of like full circular consideration when it comes to ecology and our impact on the planet. Okay, so I hope in the last 20 or so slides, you learned something new that you can take with you into the cold and flu season ahead. I know it's already started, especially in my family, so apologize for my scratchy voice. And if you do want to connect with me, I invite you to reach out. I practice at a clinic called Clementine in Vancouver. We do offer telemedicine or even phone appointments. You can book in for a meet and greet with me as well if you want to ask me some questions or just want to see whether or not naturopathic medicine is something that you like to explore. And I work with harmonic arts probably every season to give you a new webinar every few months. And so I look forward to seeing you at the next webinar. Okay.